Hello, hello, beautiful people. How's everybody doing today? On this video, it's a little bit of a travel kind of episode, but we are still going to be doing a review at the end. But I want to talk about this place called Prague, which I did went several years ago, a little recent, and understand that it is the capital of Czech Republic, right? Remember, in 1993, Czechoslovakia, right, as we all know, kind of split into two countries, uh, Czech Republic and Slovakia on the other side. And so Prague is the capital. It's the largest city of the Czech Republic. They actually call it the city of a thousand spires. And it's a beautiful city. The reason why they call it that is that, they were able to preserve 12th and 13th century Gothic, structures, almost like medieval churches, you know, medieval buildings. And as a whole, it's just very, very, it's a very historical place. It's magical, right? So, it's a city of bridges, cathedrals, gold tip towers, and church spires, right? And it's actually the 14th largest city in the European Union. It held about, I think, around 1.5 to 2 million people. So it is somewhat of a busy place. Very underrated, good food, and also I forgot. Yes, in regards with this, you saw the beer. It's the beer capital of the world. I believe per capita person drinks two beer. I think daily or something like that. But good food. I gotta say, as you see me eating right here. Very very underrated, but it's up and coming. There's tourism is very very flourishing in that city. Yeah, I enjoyed exploring it, as you can see. They do participate in coffee shops, what they call in Amsterdam coffee shops, and as you can see, they have beautiful structures. Um, a very walkable city. The metros and the trams, they work perfect. They work very orderly, on time. And by that river, by the Vatlava River, it's just beautiful sceneries around it. And I gotta say, there's a bridge called Charles Bridge, which I think is like a 14th century bridge, and it's one of the most beautiful bridges I've ever seen. More beautiful than even bridges in Paris, right? They actually call this the Paris of the East, with with Prague. As you can see here, you can actually climb up on the different spires of the churches and see a full kind of 360-degree view of the city. And also at night, it's pretty magical at night, as you can see. It has that very medieval vibe,
Guys, I'm gonna show you the
and
money
this is
shot.
me
Check this
right
out.
here
Holy cow,
on
check
top
it out!
of a roof. And more views to the top. As you could see the spires, the church spires, and the preserved structures that they were able to, you know, they've had for almost 1,000 years, right? And this dark alley, no, not alley, stairs is up on a almost like a tower, one of the most best preserved tower in all of Europe, I would say. You know, 12th century, 12th century tower. As you can see, there are plenty of people, a lot of tourists. This is one of the most beautiful structures I've ever seen. Um, and very good food, very affordable too, as you can see, because it's more away in the east, right? It's more Eastern European, so definitely, they're actually one of the most progressive, somewhat communist, countries that was broken down when Russia fell. So their per capita is very high, comparable to almost the Western European countries, and yeah, it's a very walkable. city, so you could see a lot of walking, plenty of walking, and I really enjoyed it, guys. It was a beautiful trip. Now the churches are really amazing. So you could see on the video. Um, I cannot remember the name of that church, but the city square, the historical plaza city square, you could find majority of the beautiful structures and architectures within the downtown historical district, and that's it, guys. So hello everyone, how's your NCLEX review going? Now in this review, I will briefly go over diabetes insipidus and go over a few of the contents that you will most likely encounter in your NCLEX exam instead of just going over information that are somewhat unnecessary, okay? Now, diabetes insipidus, it occurs when the body can't regulate how it handles the internal fluids in the body, and the condition is usually caused by a hormonal abnormality. And just to let you know, this isn't related at all to diabetes mellitus, okay? Now, diabetes insipidus, or DI, usually is characterized by large amounts of diluted urine and an increased thirst. So, mainly the symptoms with our patient would be polyuria and polydipsia. Okay, now there are four types of diabetes insipidus. Each of these type has its own set of causes. It's not really important to know each type, but we'll just go over it really quick. There's a central diabetes insipidus, or central DI. It's usually due to not having enough of the hormone vasopressin, which, as we all know, is an antidiuretic hormone. And this can also be due to damage in the hypothalamus or the pituitary gland, which, as we all know, the pituitary gland is the one that helps excrete ADH, okay? Or secrete ADH, I should say. Now, the next one is nephrogenic diabetes insipidus, which occurs in the kidneys and then in the nephrons, when the kidneys are also not responding properly to the antidiuretic hormone vasopressin. Next one is dipsogenic DI, or dipsogenic diabetes insipidus. And again, it's another abnormality with the hypothalamus. And then lastly is gestational diabetes, which is happens only during pregnancy. Now, diagnosis is often based on urine tests, blood tests, and what we call a fluid deprivation test, okay? Now, treatment for diabetes insipidus depends on the type, but majority of the patients should be thought to drink sufficient fluids to prevent dehydration, okay? And in central and gestational diabetes insipidus, it is treated with desmopressin. On the other hand, the nephrogenic diabetes insipidus can be treated by addressing the underlying cause and the use of a thiazide, aspirin, or ibuprofen. Okay. Now, there are a few things that you have to know for the NCLEX in relation to diabetes insipidus, and these are the important contents that I mentioned before. Now, radiation for a brain tumor can place a patient at risk for diabetes insipidus because there is a high possibility of damaging the pituitary gland, which is obviously responsible for ADH secretion. So, things we need to watch out for when a patient with a brain tumor is getting the radiation is being at risk for diabetes insipidus. Okay. Another one would be like symptoms in common with diabetes insipidus and diabetes mellitus includes polyuria and polydipsia. So you have to watch out for that. That can be a tricky question. Okay. Also, since the patient with diabetes insipidus is dehydrated and is losing water, therefore there would be a high serum osmolality. Okay, so the serum osmolality would be high, but they would have a low urine specific gravity because the patient is excreting a lot of water out of the body. So there's a high serum osmolality and a low urine specific gravity. Okay, and lastly, the client would be at risk for fluid volume deficit, and that's an obvious, since the patient is excreting that much water, they would be at risk for fluid volume deficit. Now, this is it for now, guys. This is just a quick overview, but like I mentioned before, we want to go over the most important contents that you might encounter in your NCLEX exam. Again, thank you so much, guys. I really appreciate your time. Good luck on your exam. Thank you, and God bless. Thank you. Bye bye. Hello, everyone. How is your NCLEX review going? I hope everyone is doing great. I hope you're retaining all your NCLEX information smoothly without any plenty of anxiety. Now, in this video, I want to talk about how sometimes when you will be taking your NCLEX, it can seem that some of the questions that might seem very simple, um, yet we still make a few silly mistakes here and there. You know, things can be simple, yet we can still make a logical mistake, right? So let's go over this question, which we all think it's a simple question, but the fact that it's a select all that apply question can sometimes make it a little tricky. Okay, so here's our question. The registered nurse or RN in a medical surgical unit is working with a licensed practical nurse or an LPN and also an unlicensed assistant personnel or a UAP. Now, which tasks are most appropriate to assign to the LPN, right, to the licensed practical nurse? Select all that apply. Okay, so it's a select all that apply question. 1. Administering a scheduled analgesic to a client with chronic back pain currently rated 8 out of 10. Number 2. Assessing fluid volume status of a client with heart failure who is scheduled for discharge. Number 3. Assisting with bathing, feeding, and dressing a client with multiple sclerosis. Number 4. Performing wound care and sterile dressing change for a client with a stasis ulcer. And number 5, providing incontinence care and linen change for a client with diarrhea. Okay, guys, now the first time you might see this question, it might seem like it's a straightforward, knowledge-based, easy question to have, right? But the tricky part here is that it's a select all that apply question, which means one simple error will make this entire NCLEX question a mistake, right? So first we have to look at each of the options or answers individually, one by one, and analyze if it does reflect the major question that it's asking, which is the task that is most appropriate to assign to an LPN person, okay? Now, let's look at option number 1. Now, understand that pain rated at 8 out of 10 is usually an unexpected finding in a client with chronic back pain, so don't get fooled by the level of pain. It could be a 9 out of 10 or a 10 out of 10, okay? And also obviously oral analgesic can be administered as scheduled by the LPN, and the keyword here, guys, is scheduled, okay? Although the client would have to be assessed by the RN, but since it's asking for a test that is appropriate to an LPN, yes, the LPN would be able to administer a scheduled oral analgesic, okay? Now let's look at, so 1 is definitely okay. Number 2, the LPN may perform specific assessments, but evaluating the fluid volume status of a client with heart failure, it's kind of like a comprehensive assessment, right? And it involves multiple body parts, the hearts, the lungs, maybe some peripheral edema, yeah, urine output, right? So this also, the fact that this client would also need to have a discharge education on home management due to the heart failure. This is an appropriate delegation to the RN. This is a responsibility to a registered nurse, okay? So number 2 is not very appropriate to assign to an LPN. Now let's look at options 3 and 5, which is assisting with bathing, feeding, and dressing the client with multiple sclerosis, and number 5, which is providing incontinence care and linen change for a client with diarrhea. The problem here with this, guys, is that although these tasks can be safely carried out by the LPN, it's gonna underutilize the use of the LPN, right? Therefore, this task should be delegated to the unlicensed personnel or the UAP. Okay, so because it's just an ineffective use of resources. Okay, so 3 and 5 is not appropriate to assign to an LPN. Now let's look at 4 because we kind of skipped 4. Now, wound care and routine medication administration are the most appropriate tasks assigned to the LPN because, our LPN does perform sterile procedures and, they do clean and dress the wounds. Therefore, this is a definite appropriate assignment to an LPN, okay? So, the answer for this question would be number 1, right? And number 4, okay? So, the lesson here, guys, is that we can never be complacent at all, especially if it seems like it's a very basic, easy question, right? Because with select all that apply questions, one mistake is all that it takes to make the entire question completely wrong, right? So we always have to be vigilant and make sure to always double check and always analyze every single possible option, okay? Now, this is it for now, guys. I'm just going to keep it short and sweet. Thank you so much for sticking around. I wish you the best in your NCLEX review. I hope your NCLEX review is going well. I hope you have a blessed and a productive day. And if you do get a chance, please visit the NCLEX review website, which is at allnursingnotes.com. Again, that's it, guys. Again, thank you so much. God bless. Thank you.